All right, now I'm excited to welcome Dr. Zoe Kriegel. She's actually visiting us from the University of Wyoming. So Dr. Kriegel is an assistant professor in the Division of Communication Disorders at the University of Wyoming. She's a clinically certified speech-language pathologist, and she does research as well, investigating the effects of competing demands for speech on individuals with and without Parkinson's. So she works to understand everyday challenges of communication, and she helps people with Parkinson's as far as learning more about speech acoustics, facial movements, and facial muscle activity patterns. And so we're really excited to have Dr. Kriegel here to talk with us about communication.
Good morning, everyone. I'm so thankful to be here with you this morning and to spend some time with you today. It's the 12th annual symposium, but it's my first time here. Maybe it's some of your first time here, or maybe it's your 12th or somewhere in between. And so no matter where you fall, I'm really glad to spend some time with you this morning. I want to talk with you today a little bit about communication as a two-way street. Historically, in speech-language pathology, we've focused a lot on how can we administer therapy for an individual living with Parkinson's disease and to have them do more and insert more effort, for example. And those are really evidence-based treatments, but there's also things that listeners can do. I do talk a lot, but I don't usually talk to a brick wall. And you usually probably don't either. And so listeners have a role to play in both successful and satisfying communication as well. And so there's a little bit for everyone in this presentation today that we'll get to experience together. So today's overview, we're going to talk through the impact of Parkinson's disease on speech and voice to understand a little bit more about why some of these changes occur. And hopefully you'll walk away with 1 to 2 concrete strategies that you can implement as a listener. So if you are a care partner or someone who communicates with folks living with Parkinson's disease, there will be strategies for you. If you are living with Parkinson's disease and you have friends who are also living with Parkinson's disease, these also apply to you. And so some strategies there. And then I'll touch briefly on some of the work that we're doing at the University of Wyoming related to speech and communication for folks living with Parkinson's disease. And so you may be familiar with the basal ganglia. Perhaps your physician or your support group has talked with you about the basal ganglia. This is the small subcortical region most affected for folks living with Parkinson's disease, deep in the brain, kind of buried underneath. And this area undergoes this cell death associated with Parkinson's disease. And the basal ganglia is important for several things, but what I'm going to focus on today is its role in movement. And so the basal ganglia is important for starting or stopping movements on time and choosing movements that are the right size. And so if you know a little bit about Parkinson's disease and how that affects creating smaller movements, for example, this makes sense as to the basal ganglia's role in selecting or choosing these movements that are the right size. And so an estimated 70 to 90% of folks living with Parkinson's disease will experience some changes to speech and voice at some point in the disease duration. And so we expect that most folks living with PD will experience some changes to their communication. And it's not always the case, but overwhelmingly, folks may demonstrate something called hypokinetic dysarthria. And this is what we would call a speech diagnosis under the umbrella of Parkinson's disease. So it's not something different or separate, it's kind of under that umbrella. And some individuals may experience clinical or more subtle changes in what we talk about as cognitive linguistic aspects of communication. So less about the movements themselves and more about thinking, word finding, those kinds of challenges. And so both or one of these can occur. And so what is hypokinetic dysarthria? It's really a cluster of symptoms, and this would usually be diagnosed by a speech-language pathologist, kind of in consultation with a physician. And it's a constellation of speech symptoms like stuttering or stammering, mumbled speech, soft or breathy voice. Some folks may demonstrate short, kind of fast rushes of speech, maybe monopitch, where it kind of sounds monotone, or monoloudness, where it's kind of one low level of loudness. Also, mismatches between speaker and listener perceptions, like, I don't feel like I'm quiet. We'll come back to that. So this constellation of symptoms that characterize hypokinetic dysarthria, and there can be more than one type of dysarthria that someone experiences, but this is the most common for folks who are living with Parkinson's disease. And so I want to talk a little bit about this soft voice. You might have heard a little bit about it, but I want to explain why we think this might happen. So before we do this, I need to orient you to your larynx. If I asked you to point to your larynx right now, where would you point? Okay, in the neck region. Nobody's like pointing to their knee, so we're in the right general category. But I want to introduce you to it and experience it a little bit. So first things first, I'd like you to place one hand gently on your neck and swallow. You should feel it go up and down. Great, that's your larynx. Leave it there for just a moment. There's a few different functions that the larynx does. The least important for life sustaining, and the one that I spend a lot of time thinking about, is voice. So I want you to alternate between these two sounds, the S sound and the Z sound. You should feel it vibrate. And then half the time, it's not vibrating. So you have this voice mechanism in there that turns on and turns off for all of these different sounds in whatever language you speak. And in this example, the S and Z example shows voiceless where the voice is off and voiced where the voice is on. The larynx is also important for allowing you to breathe, so staying open, and protecting your airway by closing. So right now, if you're breathing, good job. Your arytenoid cartilages are open, but I want you to experience them being closed. So I'm going to ask you to bear down, and if you want to, you can lift up on the table underneath you, like, huh. Don't let any air come out. Huh. Okay, so you should feel that really tight closure. That demonstrates to you that your larynx has the ability to close, and you also have experienced its ability to open because you're breathing. And somewhere in the middle is the position for creating voice. And what I want you to understand is that those are movements too. And as we know, Parkinson's disease affects movements. And so in this soft voice, the movements in the larynx might be too small, such that this primary impairment doesn't allow you to have a loud voice. And over time, if those small arytenoid cartilages here, these cartilages aren't coming together closely enough, over time, there might be some muscle wasting or muscle atrophy on those tissues, which then further exacerbates a breathy voice and a low intensity or low volume voice. And that creates a leaky larynx. I want to demonstrate this for you using a balloon analogy. And in smaller groups, I create a balloon choir, but we won't have you all do that together, so I'll just demonstrate this time. So I'm going to insert some air here into this balloon, and this reservoir down here will represent your lungs or the respiratory system. And up here, I'm going to valve that airflow using the top of the balloon. So I can pull it and make it tighter or looser. And this is going to represent here at the top your larynx or your vocal folds or vocal cords. So we'll have your lungs and then we'll have your vocal folds. Okay, so we have this reservoir here, and if I sufficiently pull these two sides closely enough together, it will start to produce a sound. In essence, if it had a head on top, it would be singing. And so here I'm going to demonstrate that for you if they're sufficiently close together. Beautiful. So that example demonstrates for you that the vocal folds have to be close enough together in order to produce a nice, loud, robust voice. Well, what happens if they're not close enough together? In this case of arytenoid cartilages being too far apart, or this vocal fold atrophying or wasting away of the muscles. Well, let's demonstrate. Okay, not very loud. Also didn't last very long, so some folks might run out of air. Well, why don't we just tell people to take a deeper breath? Okay, fine, I'll inflate this respiratory system as if you were taking a deeper breath and see if that solves the problem and creates that nice voice quality. Okay, so I inflated it more. This time again, I'm not going to make those vocal folds come together nice and closely. Let's see what happens. Did the deeper breath solve the problem? Not really. And so while we do know that folks living with Parkinson's disease may not take breaths that are as deep, that on its own doesn't solve the problem. We need this high effort voicing in order to valve or regulate that airflow coming from the respiratory system. And so those types of treatments like Speak Out or LSVT Loud, which I'm certified in both as a disclosure, are this kind of primary treatment option for folks who have low vocal intensity. And that brings those vocal folds closer together so you can have that nice, healthy voicing. But what about not feeling like you're quiet when everyone else says that you are? And maybe you think my spouse has hearing loss. Your spouse might have hearing loss, and you should get that evaluated by an audiologist and an ENT. However, even when a spouse or care partner has hearing loss treated, that doesn't fully explain this mismatch between how someone is producing voice and how you might feel about that. And so the current hypothesis is what's called a sensory motor mismatch, where what your body produces or the movements you put out don't match the sensations that your body interprets and that your neurological system interprets for what you have produced. And so the idea is that over time, your target for what you think you're trying to do starts to shift. And I want to show you this example here. So I'm no archer by any stretch of the imagination, but I think this illustrates the point quite well. If you were an archer and you made this attempt, here's the purple arrow that's placed here within the blue, that's objectively not a bullseye. You didn't fully airball, but it wasn't a bullseye. And so on the next attempt, you might make a change. You would see like, oops, I didn't get the bullseye there. I didn't meet the target. I'm going to make a change so that hopefully you get on the next attempt closer to this yellow, to the bullseye, okay? You noticed an error and you were going to attempt to fix it next time. But what the current hypothesis is for folks living with Parkinson's disease is this one on the right. Notice that the arrow is in the exact same position, but this time the bullseye is bigger. So if you made that shot, if you made that attempt, bingo, you made a bullseye. You don't need to change a thing next time. And so the same is true for something like loudness. If the target, this subconscious target inside your mind or your representation has shifted, now when you're quiet, that system does not automatically say, oh, try again, be louder next time. Instead, you're all good. There's no error at all. And so this is the current working hypothesis as to why folks living with Parkinson's disease may not feel that sensation that they may be too quiet. Folks living with Parkinson's disease who are experiencing hypokinetic dysarthria may also have imprecise articulation. This is a dynamic structural MRI. You should be able to see the tongue moving around a lot in that oral cavity. That's what speech looks like. That's a lot of movement. Those movements of the tongue, lips, and jaw during speech can also become smaller, just like any other movements, like walking or even handwriting. And so I want to give you a couple of examples. The sounds p and b in the English language require full closure of the lips. You have to fully get those lips to seal off that airway and create those sounds. I want you to practice and experience this. I want you to say this phrase, I owe you a yo-yo. Say it 5 times, just as you typically would. I owe you a yo-yo. Okay, I chose this one because it's continuous and you can really feel that tongue moving around. Now I want you to experience this treatment approach that speech language pathologists may use called clear speech. And this time I want you to over-articulate all of the sounds in the words and try that phrase again using clear speech. See what that feels like. I got a lot of yo-yos coming my way. And so you should have been able to feel that significant difference. You can also increase the magnitude or amplitude of movement for these articulatory skills or movements as well. And so this is something that a speech language pathologist might work with you on. And it's not just as easy as saying speak clearly. It takes some training. And so that might be something that an SLP works with you on. I want to talk just a little bit about speech disfluencies, and it's something that in my lab we're quite interested in understanding more about why these might happen and under what conditions. Speech disfluencies are difficulty getting speech started or initiating that movement, perhaps repeating speech sounds or speech syllables, and they most often occur at word beginnings for folks who are living with Parkinson's disease. We don't know much about what to do about this experience, but we do know just a little bit. If someone is experiencing speech disfluencies and they read a passage more than once, every time they read the passage or that paragraph, those speech disfluencies become less frequent. So now, I don't speak from a script. Perhaps I should speak from a script more frequently. But many of us, we aren't doing these repeated types of speech production. However, if you do things like readings at a religious gathering, or you have a planned speech for a family function like a wedding, or perhaps you lead your Rotary Club or some other social club, this is a really nice strategy to practice your speech ahead of time because disfluencies will become less frequent. And that's because it's essentially a motor skill like learning to golf or a dive off of a diving board. That's at least how we interpret those data. And so I want to play you an example about what this sounds like. And before I play this example and a couple of other examples in this presentation, I do want to say that the folks in these examples have participated in research and have generously provided their consent to these recordings being used for educational purposes to teach people things, just like we're doing today. And so super grateful for those folks who have provided those samples. This person is living with Parkinson's disease and is answering the question, would you rather be rich, famous, or influential? And I'd like you to listen for speech sounds that are repeated during the spoken response And these seem to be motoric in nature, not really related to finding the right word. So here's that sample for you.
I would choose influential because I think it is important to give people the right impression as to what your life's about and what they can expect. Famous would be nice too, but I don't think I could ever be famous. Cause I don't do anything that makes me famous. I'm just an ordinary person with ordinary with ordinary values and beliefs.
And so this is a really kind of illustrative example of what those speech disfluencies may sound like. And perhaps you or someone you know are experiencing these speech disfluencies. And again, in my lab, we're trying to better understand what might be causing these from moment to moment. And we do know that if you practice some sort of speech task, you would get better at it. I want to shift gears for just a moment and talk about word finding difficulties. And this is difficulties retrieving the intended lexical item or the intended word when faced with a naming task or during a conversation. And so it might feel like a tip of the tongue phenomenon, and you just can't quite land on that right word. And this phenomenon is exacerbated by acute stress. So if you experience this word finding challenge and you're in a conversation and you begin to become frustrated by that experience, unfortunately, that makes it less likely that you will come up with the word that you are trying to find. Now, it never works to tell someone to be less stressed. That usually does the opposite. Yeah. So it sounds like it's really simple, but this is actually something that you would practice experiencing and not becoming distressed by during a conversation through treatment with a speech language pathologist. So it's much easier said than done to not have it exacerbated by acute stress. And we know that folks may retrieve the word after a few seconds, or they might choose to abandon the word and just move on with the conversation. But we're going to talk about a strategy. This is one strategy called circumlocution. And this is using descriptive language or paraphrasing an idea when the precise word is difficult to recall. And so this means literally talking around the word. And again, this is something that's easier said than done. So we're going to practice it here today. This would be something you would practice in treatment with a speech language pathologist if you are experiencing word finding difficulties that are really bothersome to you. But we'll give it a try today. I need you to be in pairs or groups of 2 or 3. And this includes you folks in the back. So find 1 or 2 people. We're going to practice this technique. And before I kind of turn the floor to you, I have a couple of instructions for you. One of you is going to describe the word on the screen without saying it. The other of you is going to try to guess the word. So in your groups of 2 or 3, you have to determine who's the describer and who's the guesser. And when you do that, the guesser needs to turn away from the screen. Okay, so your job is to identify who's the guesser, who's the describer, and the guesser needs to turn away from the screen. When you have your groups and your jobs, raise your hand to show me you're ready. Okay, so the folks who are guessing, do not look at the screen. The folks who are describing, here's your word. And if you're finished, raise your hand just to show me you're finished. So just a few more seconds for folks finishing up. And let's come on back together. Now, if you didn't get it, it's because I gave you a really hard word. This is an abstract noun, so you can't describe what it looks like, for example. So you may have experienced that it was challenging, and the more abstract it is, the more challenging it is. So let me give you another one. And when you think you know what it is, feel free to holler it out nice and loud. So what if I gave you a concrete noun, like it's something long, it's something you eat, it's yellow. Okay, right? So it's easier as a banana. It's easier when it's a concrete noun. Okay, so this kind of abstraction really illustrates the challenges that you might experience within a conversation. The other thing is you're not usually describing it necessarily for the other person to guess. When you use this technique, it gets your word finding closer to the word you want. So the experience will be different when you don't know the word you're describing. That's why you're describing it. And so circumlocution has two functions. Number one, by describing everything around the word that you intend, it gets your system closer to activating the one you mean. It also, and this comes with a caveat that we'll talk about in a moment, it might help your listener guess the word you want if you want them to. So two functions. It helps you get closer to it, and if you want them to, it helps the listener get closer to it. And so let's talk a little bit about communication breakdowns. And so if you are a care partner or someone not living with Parkinson's disease, this is especially for you. Communication breakdowns may hinder communicative independence and satisfaction, and may introduce miscommunications. This especially happens when someone introduces a new topic, or if they start talking about someone in the conversation that they didn't talk about before, a new referent, and you start saying, well, I saw Mary the other day and she started doing this and that, and then she went down the road and she got lost at the grocery store. If they didn't hear Mary, then they don't know who you're talking about. So these new person, referent, bringing up new reference and new topics can be pain points. And feelings of frustration, through conversation might introduce pain points into relationships. These are frustrating experiences. And so what can be done to facilitate communication? The first is to identify a miscommunication as soon as you possibly can, close to the source. This is because conversation happens at a really fast rate. People, despite what we think about conversation happens in fragmented sentences. We don't talk in complete sentences. People talk over each other in not interruptions, in a really beautiful dance as to construct conversation. And so it's messy. If you can identify that a miscommunication has occurred as quickly as you can to the source of that miscommunication, it will get resolved more efficiently. And so one thing that is possible is to pause another moment just to think. So if you aren't quite sure what someone has said, instead of immediately asking what, can you challenge yourself to wait just 1-2 seconds and try to construct what you think they might have said? If someone's experiencing word finding challenges, provide them with additional time to identify the word they're trying to find. And here I have, should you fill in the blank? This is super individual, whether folks prefer a listener to try to fill in the blank or not. So just by a show of hands, if you have word finding troubles, raise your hand if you like for someone to try to guess the word. Okay? So a few folks, raise your hand if you really get irritated by that. Okay, so a handful of folks either way. Some people, this can often be a dispreferred strategy. So someone trying to guess the word really disrupts the speaker in trying to identify that intended word, especially if it's wrong. It might lead them down a path over here and they're like, nope, that's not what I meant. But some individuals prefer this. I have a dear friend in Laramie who says, no, I want the conversation to keep going really fast, so I want you to guess the word. And the more context, shared context you have with someone, the more likely they'll be successful in guessing the word. So someone you spend a ton of time with, they have a lot of information about what you're probably trying to say. They're more likely to successfully guess the word than someone who's a stranger, for example. And so it's important to check with the person who you talk with. Do you like if I try to fill in the word, or is that something that bothers you? Another communication facilitator is to repeat back what you think you did hear. So even if you didn't understand, repeat back what you think you did hear, even if you're wrong. And so I want to give you this example. I use my Alexa a lot. I use it, one of the main ways that I use it is to create my shopping list. And so if I'm in the bathroom or I'm cooking or I'm, around the house and I notice that something's running low, I'll say, Alexa, add coffee to my shopping list, for example. And that creates my shopping list. Let me tell you, it's a pretty good strategy. But I want to show you this example and play for you a miscommunication through this smart speaker. Alexa, add coffee to my shopping list.
I've added toffee to your shopping list.
Did you hear that? Slight miscommunication. Now, we could have a whole speech science lecture about how those sounds are similar to each other. We'll save that for next time. But in general, if I were to repeat this for the smart speaker, I would make a strategic change in how I repeated that sentence. So I would say, no, Alexa, no, add coffee to my shopping list. And I would emphasize the word that was misunderstood. And so this is a nice example of when you repeat back what you think you heard, it gives the speaker information about what to emphasize when they try again. And maybe they don't have to repeat the whole phrase because they're just repeating the key words. It also demonstrates as a listener that you are actively trying. You're not just saying what at the first moment that you didn't understand, which is often just almost automatic for us. So I want you again in your pairs to try this. This is a sentence, again, this person allowed us to use this sample for education purposes. And they're producing a sentence that's kind of odd, so you won't be able to use context clues to help you. I've also mixed it with noise to make it a little harder. And that's because in everyday communication, it's far more complicated than you listening intently as you're so delightfully doing right now. That's not how real communication works. And so I've made it a little bit more challenging for you. So I'm going to play this. Choose one person who's going to say what they think they heard, and one person is going to be the listener. There will be 2 chances to do this, so everybody will get your money's worth today. So choose a listener and choose someone who's going to try to say what they heard. Raise your hand when you're ready. Okay, so I'm going to play this. I want you to say, even if you only get 1 or 2 words and you are really confident that you're not correct, I want you to give it a try. So here we go. Here's the sentence.
Sickness kept him home the 3rd week.
Did you get 1 word? Okay, here is what the sentence was. Sickness kept him home the 3rd week. So you might have experienced that it was kind of uncomfortable to give it a try and not know what exactly they said. But that's the point, is that you're kind of putting yourself out on a limb to say just anything you think you might have heard. And maybe you surprised yourself and you got more than one word. And when you do that, you've helped the speaker not have to repeat the whole sentence. Okay, this is equal opportunity. So now we're going to switch roles, and the other person is going to give this next one a try. So if you were the listener last time, now you're going to be the speaker. So here's your chance. Here we go.
Lift the square stone over the fence.
Lift the square stone over the fence. So I saw a couple of high fives, so maybe folks did better than they expected. Nice. But again, it kind of surprises you how uncomfortable it is to give it a try. And so this is something that seems simple, but it does take practice. And so when I use this technique, I'll usually say something like, I'm sorry, I think you said something about the fence. And again, that demonstrates that I'm actively participating and actively attending to the conversation. And it also gives the person an opportunity to focus their feedback and focus their correction or their repetition on the source of the trouble. And so these preferences of whether folks like some of these techniques or don't, they may vary in public settings versus private settings. So it's not just ubiquitous, you always use the same tool. Strategies that work best with a care partner or a close friend may not work best with other people. So it really takes trying these on and trying something else if it doesn't work. And as a listener, you can ask if a strategy is preferred or dispreferred. And if you feel like you don't really know what your strategies might be, that's when you talk with a speech language pathologist and ask your physician if it seems like a good time for an order for a speech language pathology referral. If you've never been to speech therapy, a really nice foundational resource is the Speech and Swallowing Guide from the Parkinson's Foundation. It gives you a nice understanding of what the possibilities are in treatment. It's free. You can see the digital version or for free request the physical copy. And I would recommend folks review this before seeing a speech language pathologist because it gives you an idea of what questions you might want to ask. Before I turn it over to a few minutes for questions, I want to talk a little bit about the research that we're doing at the University of Wyoming. Here you are seeing a video of my undergrad research assistant who has worked really hard this summer on a small grant that we've been working on. And you can see her, this is a structure of her face, and we've captured it in 3 dimensions. And we can measure how big are her speech movements, how fast are her speech movements. And this is a technique that's been around for a couple of decades, and it's highly accurate. Like even within smaller than 1 millimeter, we can track really small movements. But you have to come to my lab in Laramie, Wyoming, to be able to participate or to use something like this in clinic. So it's super inaccessible. And so raise your hand if you have a cell phone with a camera on it. Keep your hand raised. Raise your other hand if you also have a tablet or laptop with a camera on it. Holy moly, there's a lot of cameras that y'all have access to. And so we started to think about, well, how can we use artificial intelligence or machine learning techniques to create individualized, ongoing feedback as a first step in video calls? So can we measure movements in a way that means something or can help people with these cameras that everybody has access to and is familiar with using? And so we're thinking about how can we develop discrete, personalized notifications to tell someone to improve their speech clarity instead of needing to rely on a listener to say, oh, I didn't hear you, or for you to constantly be thinking and using resources to not only say your message, but to say it clearly and loudly. And so if you're interested in learning more or keeping up to date on the research that we're doing up at the University of Wyoming, feel free to scan this code or chat with me later. This is something that we'll be doing for a few years into the future. And so key takeaways here are that speech and voice are impacted by hypokinesia in Parkinson's disease. Listeners can take an active role in supporting successful and satisfying communication. And some ongoing research aims to both understand and support successful communication for folks living with Parkinson's disease.